anyway. So why is he doing it down there? No, I am doing interview online, internet. And the surrounding, the noise, it's constant, I can't hear anything. I'm working. When I finish, I'll tell you, then you stop. Because it's noise. Good afternoon. I have an online interview and it is disturbing, the feedback, the noise. It's only for 30 minutes. When I finish, you can continue. Thank you.
Good morning, everyone. Good morning to all our 255, live viewers, right here on Webinar Jump. And today this is going to be, of course, one of the most amazing. And of course, we are going to venture to another history, as we unfold, the idea of what we want to, of course, bring to all of you. One of the most exciting thing, that is going to be happening today is, of course, we will not just only understand, how we can promote, reproductive health, but we will also be hearing straight answers, from four of our experienced, and renowned panelists in the industry. So joining us today, we have our first panelist all the way from the Philippines, and she is actually an experienced obstetrician and gynecologist. No less than, ladies and gentlemen, please welcome, to this first ever International Medical Forum powered by Immeri, Dr. Glenda Pichay Rabino. Hello, Dr. Glenda. Good afternoon from Nigeria.
Good afternoon.
Yes. Can you please greet
Good evening from
everyone?
the
All right.
Philippines.
So welcome.
Thank you.
Wow. So how is the situation right now in the Philippines? So all of us are very excited for today, and we are very happy to have you. So next, of course, in this International Medical Forum, we are joined by another experience, doctor all the way from Ghana. Ladies and gentlemen, please welcome, it's a medical doctor, no less than, Dr. Mercy Apia. Hello, Dr. Mercy Aquaba.
Hello.
Yes, so right now we have 289, live viewers who are joining us today, and everybody is very excited, So of course, learn, another information, new set of information from our experience, panelists for today. So we are very happy to welcome you, on board with us, in this first ever International Medical Forum, and we are building, as we speak, right now, we are building our attendees, and we're expecting 2,000 participants today, and this is going to be, of course, a mind-blowing, a mind-blowing event. And our third panelist, of course, for sure, all of you, knew him, all right? So he is no less than what's this? A director, of iGrowth University from Southeast Asia. Ladies and gentlemen, doctor of naturopathy. Ladies and gentlemen, please round of applause, for Dr. Khan Kokming from Malaysia. Dr. Khan, good
Hello,
morning.
Aris. Hello, everyone. Good morning. Hi, Dr.
Wow,
Glenda.
wow.
Hello, Dr. Mercy.
Yeah, we are very excited. And also today we are joined by one of our experienced, assistant sales manager, and she is also an experienced nurse, she's a registered nurse. Ladies and gentlemen, please welcome, with me, right here in Immeri Studio, from Immeri Studio, live from Immeri Studio, no less than the assistant sales manager of Immeri Nigeria, Miss Anne Aguilar. So before I bring her in, I'd like to remind all our participants, that please let's focus, with this presentation, because this is gonna be, of course, not just mind blowing. This is going to take us to the next level of experience, so we can, of course, apply, the practical things, that our doctors will be advising everyone, and that they are going to share, in the course of this first ever International Medical Forum powered by Immeri. So please prepare your pen and paper, take down notes, and if you have questions, we will be happy to answer you, later as we progress, in this first ever forum powered by Immeri International. So I'd like to, of course, bring you, to this very forum, no less than, our official host, Miss Mayan Aguilar. Yay!
Thank you so much once again, Mr. Aris, and good morning, good evening, good afternoon to our panelists, and of course to our 313 viewers as of the moment. To our viewers from South Africa, from Ghana, from Philippines, Brunei, all over the world, from China, from Taiwan. Good day to everyone. Okay, thank you so much once again, Mr. Aris. And of course, it's a great honor and privilege for me to host this first international medical forum together with these amazing personalities in the medical field. As Mr. Aris mentioned a while ago, the topic or the main topic for this medical forum is understanding women reproductive health. And I'm sure, like me, everyone is so excited to learn more about the female reproductive health. And without further ado, let me once again introduce you our first panelist for today. Let me give you a short recap again of this amazing person, one of my favorite person in Immeri. He is a naturopathic doctor and also a health consultant all the way from Malaysia, Dr. Khan Kokmin. Hello, Dr. Khan.
Hello, May Ann. How are you?
Hello. I'm great, Dr. Khan. How are you, Dr. Khan?
Yeah, I'm good. Thank you.
So once again, welcome. So I'll go straight ahead of our questions with this forum already. But I understand that you have been traveling almost half of the world from east to the west, meeting and educating a lot of women about their reproductive health. So can you please share with us about these experiences during your travel?
Well, since 2 years ago, I have the privilege to promote women reproductive health through various training and health seminars in several countries in Asia, Africa, and Middle East, including Malaysia, China, Philippines, Ghana, Nigeria, Egypt, and also Sudan.
Okay. So
Yeah.
with these travels, Dr. Khan, I believe it's
Yeah.
more on Asian countries and African countries. What are the
Yeah.
common questions you have been encountering from those women that you have been meeting from these countries? Not meeting, but
Well,
those you have interviewed or you...
well, because we are trying to create awareness in women about the importance of reproductive health and provide also alternative and natural solutions to those who are suffering from gynecological problems. So usually they will want to know more about how to get rid of their gynecological discomfort, such as abnormal vaginal discharge, aging, through natural method without relying too much on the medicines. And most importantly, they also want to know how to be young and tight again, to make their husband love them more.
So these are the common questions from the women that you've been encountering. So, Dr. Khan, are the
Yeah.
women that majority of the women that you are encountering, are they aware of the importance of reproductive health?
Well, not really. From my personal observation, they have very little knowledge about the reproductive health. For instance, they don't even know the pH of the vagina is supposed to be slightly acidic. And oftentimes, they also take the reproductive tract infections too lightly, and without knowing the consequences the infections may lead to. And sometimes they also use a wrong method in maintaining the hygienes of the reproductive system, such as frequent douching, wearing the same sanitary pads all day, or over cleanings of with a feminine watch.
Okay.
Yeah.
Dr. Ken, can you
Yeah.
share with us if you have the statistics of women reproductive problems in those countries that you have traveled?
Well, as far as I'm concerned, and the major reproductive problems in Africa are infertilities and uterine fibroid. Maybe Dr. Mercy can correct me if I'm wrong. And the infertility rates varies with countries. And the primary infertility can be up to 6%, and whereas the secondary infertility can be up to 25%. And the rate of this uterine fibroid is also relatively high among African women, and it can be up to 60 to 80%, which means 6 to 8 out of 10 women may have these problems. And these two problems are also significant in Asia, but at a lesser percentage, and contributing to about 3 to 20% for infertility and 30 to 40% for uterine fibroid. And of course, cervical cancer has also risen, especially among the young women. And also, aside from these two major problems, from my observation, vaginosis is also high in these two continents, and including, contributing about 25 to 40% among the women. So these are my observations.
Okay, so basically, Dr. Khan, both these
Yeah,
continents, Asia and Africa, almost have the same or mutual issues in the reproductive system, right?
correct, correct.
Yeah. So thank you so much, Dr. Khan. Later on, we will be
You're
asking
welcome.
more questions about these issues to our two beautiful doctors. So thank you so much, Dr. Khan, for sharing your insight on how the woman reproductive health is being observed in different countries. So I'm sure this insight that you have shared with us is an eye opener to everyone. Okay. Once again, thank you so much, Dr. Khan, for your time
Yeah,
for
thank you, May
today.
Ann. Thank you.
Okay. Thank you so much. I'm sure everyone is excited to hear also some insights from our two doctor. But before that, okay, let's watch this short commercial break. And you're still tuning in our first International Medical Forum, and I won't take much of your time. Let me introduce to you once again our next panelist. She is a medical doctor all the way from the beautiful country of Ghana, Dr. Mercy Apia. Hello, Dr. Mercy. Good morning, good
Hello,
afternoon
and
in Ghana.
good,
Hello, Dr.
good
Mercy.
afternoon.
How are you doing, Dr. Mercy?
I'm fine, thank you. How are you?
I'm great. I'm great, Dr. Mercy. I know you are very busy of your duties as a doctor, especially with this pandemic season. But we appreciate your time for giving us your time for this forum today. So as I've mentioned a while ago, I won't take much of your time. I will go straight ahead with our first question. Is that okay, Dr. Mercy?
That's fine.
Okay. So let me start with the Q&A portion, or our first part of the Q&A portion. So, Dr. Mercy, can you tell us how important is a woman reproductive health?
Okay. So reproductive health, from the word reproduction, means continuation of life. So the reproductive system or organ of a woman is very important. And number one, that is where life begins for everybody. All of us, in a way, came through a woman's reproductive system. So the reproductive system, it produces the basic unit of life, that is the cell for reproduction. And then when there is success in fertilization, the reproductive system of the woman houses the fetus or the human being that has not come out of this world for 9 months. So it is very important. That is where life begins for every one of us. That is why when there is a problem with the woman's reproductive system, it is a big worry and a disturbance for the woman and her family. So it is a very important system in the human system, more especially for the woman, because that is where life begins for everybody.
Wow, thank you so much, Dr. Mercy. A while ago, Dr. Khan has mentioned some of his observations during his travels of the common problems of women around Asia and also some countries in Africa. So, Dr. Mercy, let me ask you, what are the most common women reproductive health issues that Africans are facing nowadays? Could you share it with us?
Yes, I want to continue from when Dr. Khan started from. Most of the problems cut across, but mostly in Ghana and Africa, we have vaginal discharges, which could be a result of bacterial vaginosis, vaginal candidiasis, pelvic inflammatory diseases. Also on the chart, we have fibroids. We have a lot of gynecological problems, but fibroids is very, very, very common for a doctor who sits in the consulting room. And then after fibroids, we have infertility. Somebody will say we are having so many children in Africa, but it is not enough. We have a lot of infertile women who want to have more children. Everybody wants to have a child of her own. So infertility is a problem. And then we have polycystic ovarian syndrome, or the cyst in the ovaries, and all the gynecological conditions you can mention. But for Ghana, the conditions that give discharges, bacterial vaginosis, candida infection, pelvic inflammatory disease, fibroids, infertility, and then the others. So these are the common ones that we encounter on the continent.
Okay, so Dr. Mercy, can we just tackle maybe two of these main issues that Ghanaians or Africans are facing? Let me just check on the infertility. So what is the major cause of infertility?
Okay, so infertility naturally has so many causes. For some reason, some infertility have no cause. The doctors will do all the laboratory examination and find no cause. That could be a result of your reproductive system not being in the right balance. Number one, Dr. Khan said the pH of the vagina. Most women do not know that the pH has to be slightly acidic for the sperm or the semen to have a good environment for fertilization. So number one cause of infertility is unknown. Nobody knows, because there is a basic problem in the woman's reproductive system. And then also, it could be fibroids occupying the womb of the woman. Anytime there is implantation, the baby is formed, the fibroid will push the baby out and the woman will have a miscarriage. So such a woman we term as infertile because she cannot carry the pregnancy to the 9th month or to term. And then other factors like, there are so many. I just want to talk about two: fibroids and then bacteria.
Fibroid and also, that is the two main causes of this infertility: the bacterial vaginosis, and of course also fibroid, as you've mentioned. So, Dr. Mercy, as you've discussed the common cause of this infertility, what are the usual or the preferred mode of treatment for the management of these issues?
Okay, so if you're a woman and you come with a gynecological problem, of course, we will send you to the laboratory for investigation. And we identify the cause. If it's a bacterial infection, we give you the everyday bacteria antibiotics that we know, very common. And then if it's a fungal infection caused by a fungus, we'll give you antifungal. If it's a viral infection, we'll give you antiviral. Then you go home and then come back. But the problem is nobody has really taken a look at how to prevent these things. That is why the women keep coming back. We are all used to the traditional way of finding the cause. After we find the cause, we find the solution. But what can you do for the woman not to come back? That has been the challenge over the years. So we do antibacterial treatment, antifungal treatment, and then antiviral treatment. We solve whatever the problem is, but actually there is not much of prevention. That's why I'm sure this conference has come into existence, so that we educate our women on how to prevent such infections from affecting the reproductive system of the woman.
Yeah, thank you for bringing that in, Dr. Mercy, because later on, I'll be asking a lot of questions about how to prevent these common issues for women, okay? Because usually, as you mentioned, a lot of women will ask the treatment for all of this, but they forgot to ask the questions regarding prevention. As we always say, prevention is always better than cure, and it's less expensive than cure. Okay, so my next question, Dr. Mercy, is that will you accept any alternative treatment if given the product availability in the market?
Of course. In Africa, the continent, we used to have our traditional way of treating ourselves until the foreigners came in and they introduced us to all these chemicals that we have all accepted. But if there is a way, a traditional, organic, non-harmful way of helping the woman, why not? I will gladly accept it for my practice.
So, thank you so much. So it's safe to say that in your medical field, it is also acceptable for you to practice alternative treatment, right, Dr. Mercy?
Yes.
Thank you so much, Dr. Mercy Medasepa. Thank you so much. With these few questions, you've answered a lot of questions already. But for now, you can just relax for the meantime, and later on, we will move on to the part 2 of our Q&A portion. Okay. So I still have, as I mentioned a while ago, I still have a lot of interesting questions for you, Dr. Mercy. Thank you so much once again, Dr. Mercy.
Welcome, Mary.
And now let us move on already to our next panelist, okay? Moving from Africa, we would like also to hear any difference on the status of women's reproductive health in the other side of the world, okay? All the way from the Pearl of the Orient, my country also, From the Philippines, let us all welcome our licensed and experienced obstetrician and gynecologist, Dr. Glenda Rabino. Good morning, good evening, magandang gabi po, Dr. Glenda.
Magandang gabi, kababayan.
Kababayan, yes. Ako isang Ilocano din po. Okay, good evening in Philippines, Dr. Glenda. So how are you doing, Dr. Glenda?
I'm fine, ma'am. How about you?
Yeah, good evening. I'm great also. It's nice to have you here in our platform for the first International Medical Forum, Dr. Glenda. So without much further ado, let me already ask you the first question. I've asked Dr. Khan a while ago what his experiences or the common issues that he has been experiencing or he has not been observing from different parts of the world. Dr. Mercy also shared with us the common issues in Ghana. Now let me hear you. Let me ask you some questions also, Dr. Glenda. So do you think women reproductive health nowadays is very important for those women in the Philippines?
And thank you for that question, ma'am. Before anything else, first and foremost, I would like to thank Immeri for inviting me to be one of the panelists in this international forum. It's really a great honor and privilege. So your first question, yes, I think reproductive health in women is very important nowadays, especially on my field of practice in obstetrics and gynecology, because this is what we are all trained for. So we assure and address different issues in women's life, like childbirth, birth control, screening of infections, menopause, and the like. And in the Philippines, we have these reproductive health issues that it's very challenging for women because of the increasing number of sexually transmitted infections. Actually, we have a lot of HIV and teenage pregnancy in the Philippines. So
Okay.
our active law in our country, the most important provision is to provide an accessible, medically safe, effective, and quality reproductive health services.
Wow, that is a great news, Dr. Glenda. So another question, Dr. Glenda, you've mentioned some issues a while ago. Can you just pick two main issues in the Philippines or two most issues in the Philippines regarding with the reproductive health?
Actually, because Filipino face these reproductive health issues, especially now with our pandemic, COVID-19 pandemic. So everybody's stressed. So we know when we are stressed,
Okay.
there are stress-related diseases like the bacterial vaginosis, as you have mentioned. Because when you are stressed, there is an alteration of our reproductive system, like the vagina and the other reproductive organs. So this is a condition when there is an increase or proliferation of the bad bacteria and the decrease of the beneficial bacteria, leading to decrease on the pH. That's what Dr. Mercy had mentioned a while ago. So when you have that, you will have foul smelling and excessive discharge. And another is, as you have also mentioned, that the yeast infection or the fungal infection, as compared to bacterial vaginosis, which is increase in the pH, in yeast infection, you have a decrease in the pH also that would lead to itchiness. So another stress-related condition, I think, is the polycystic ovarian syndrome, which is very common also in the Philippines.
Okay. Wow, it's actually an eye-opener. I'm sure, Dr. Glenda, a lot of women, not just in Africa, not just in Philippines, only thought that bacterial vaginosis is caused by wrong hygiene or other things, but they haven't thought about stress. That stress can also cause imbalance in the hormones of the woman's body that can cause bacterial vaginosis and other infection. Well, thank you for that information, Dr. Mercy. So another question like the one I've asked Dr. Mercy a while ago. In Philippines, Dr. Glenda, what are the common or usual preferred treatment or management with the common issues that Asians or Filipinos are suffering?
Okay. The gold standard of treatment is still the antibiotics for the bacterial vaginosis and antifungal for the fungal infection or the yeast infection. However, some women, while taking these antibiotics, they have the probability of development of a fungal infection, because it can not only kill the bad bacteria but also kills off the beneficial bacteria that will prevent the growth of this yeast infection.
Okay, so these antibiotics that are the common treatment for these issues can also have another side effects in the long run, because as you've mentioned a while ago, it can kill the bad bacteria but can also kill the good or the beneficial bacteria that is helping the good health of the reproductive system of a woman. So another question, Dr. Mercy, as I've asked, Dr. Glenda, could you please share with us, okay, the PCOS statistics in your country, in Philippines? Because I've learned that it's also one of the major problems in the reproductive health in Philippines.
Yes, polycystic ovarian syndrome is prevalent in the Philippines. Actually, it has 3 to 10% parallel to the WHO prevalence rate in the reproductive age group. So polycystic ovarian syndrome is really a genetic disease or hormonal disorder that comprise of three. Since it is a syndrome, it has three features. So when there is an imbalance of the hormone, you could have abnormal menstruation. It can be infrequent or prolonged menstruation. And another feature is when there is a high hormone of the male or the androgen, that can lead to acne, the appearance of acne, or hirsutism, excessive hair. And the last feature is when you see an ultrasound, when there are numerous fluid, collection of fluid, that is the follicles, that cannot undergo maturation to be released during fertility period. So these are the features of the polycystic ovarian syndrome.
So so it really has a lot of features, meaning, Dr. Glenda, there's no specific treatment for PCOS, because as you've mentioned, there are three different features for PCOS, right? So, but what is the usual preferred mode of treatment for these common features of PCOS?
Actually, the treatment of PCOS can be based on the different presentation of the patient. If the presentation is abnormal menstruation, of course, we have to regulate the menstruation by giving pills or hormones. Okay, and at the same time, it can also address the problem of the acne and the hirsutism or the excessive hair. Okay, and if the problem is the inability to ovulate, can cause infertility, we are giving ovulation induction medication, okay, in order for the eggs to be released. Okay, and another feature, one of the most feature of PCOS is the insulin resistance, meaning there is a tendency of development of diabetes mellitus because the insulin is insensitive. So that carries the sugar or the glucose of the body, that eventually lead to diabetes mellitus. So we are giving metformin to insensitize the insulin. Okay, but the most important treatment of PCOS is still exercise and diet.
Wow. Okay. Thank you so much, Dr. Glenda. So you've mentioned the preferred usual mode of treatment for this features of PCOS and also the bacterial vaginosis a while ago. So my last question for the first part of our Q&A, Dr. Glenda, is that will you also accept any alternative treatment if given the product availability in the market?
Of course, we generally accept alternative treatment, especially if our patients are contraindicated to the gold standard of treatment. So we accept, especially if we address it's not safer, and
Mhm.
of course, the affordability also we have to consider.
Wow. Thank you so much, Dr. Glenda. Thank you so much, Dr. Mercy. So that ends the first part. It's just the first part of our Q&A portion. Later on, we will have more exciting questions for you. As I've mentioned a while ago, I've been asking more of the treatment, what are the causes, what are the problems. Later on, we will be more talking about the prevention of these common issues among women. And of course, to our viewers up there, you can type your questions, and the speakers or our panelists will try to answer all of these questions in a while. Okay, so thank you so much once again, Dr. Glenda and Dr. Mercy, for a very informative discussions on women's reproductive health. Definitely, this forum is getting more interesting, as I encourage everyone, as I've mentioned a while ago, to drop your questions. Okay. And of course, moving on. So for now, Dr. Mercy and Dr. Glenda, you can just relax for the meantime, and so you can get ready for the part 2 of our Q&A. Thank you so much, Dr. Glenda and Dr. Mercy.
Thank you.
Okay. So now moving on. Okay, of course, as I've mentioned a while ago, we still have one more panelist that is with us today. Okay. It is our privilege to have the representative from Immeri, our event sponsor, to be one of the panelists in this medical forum. She is a product trainer of Immeri and also a senior nutritionist. Wow. Let us all welcome all the way from Malaysia, Miss Michelle Pang. Hello, Miss Michelle. Okay. While waiting for Miss Michelle, let me just remind everyone that if you have questions for our viewers, for our 418 viewers as of the moment, if you have questions, okay, you can drop your questions at our comment box, and the speakers or our panelists will be answering them later on. Hello, hi, Miss Michelle. Good morning.
Hello, good morning, man.
Hello, good morning. Good evening
Hello.
in Malaysia.
Yeah. Yes,
How are you doing, Miss Michelle?
I'm great
Okay,
and
so
excited.
excited. Me also, I have a lot of questions prepared for you, and I'm very excited. I'm sure these are also some of the questions of our viewers. Okay, so my first question is: a while ago, we've showed a commercial about this beautiful product, the Vagine Refreshing Intimate Gel. So my first question, Miss Michelle, is that
Yes.
could you please share with us what motivated Immeri to launch such products, and how many countries have you distributed Vagine so far?
Okay. Well, thank you, May Ann, for the question. And yeah, my slides. All right. I believe we have heard from Dr. Khan, Dr. Mercy, and Dr. Glenda on the female reproductive problems that women encounter, which include bacterial vaginosis, yeast infection, PCOS, excessive discharge, itchiness, so on and so forth. So from the statistic, allegedly 90% of women has experienced some sort of vaginal infection in our lifetime. Okay, this is due to factors, for instance, living condition and pathogen contact. In our daily life, it's very easy for the vagina to come into contact with a bacteria, for instance, through urine and feces from swimming pools, public toilets, public transport, etc. Therefore, increasing the risk of vaginal infection. And secondly, lifestyle. Improper lifestyle, such as sitting for long hours, okay, wearing tight-fitted jeans, pantyhose, leggings, too long of an interval for the change of sanitary pads, poor hygiene, washing the vagina with alkaline cleaning agents will lead to bacterial proliferation in the vagina, which will eventually lead to vaginal infection. And thirdly, pressure of modern life. So according to the World Bank statistic in year 2019, women's involvement in the labor force is at 38.8% globally, which means 4 out of 10 people who is in the labor force are women. So I have actually extracted the statistic from the World Bank report for respective country. As you can see here, Brunei, 42.8%. It means that 42.8% of women in Brunei are involved in the labor force. And Egypt, 23.6%, Ghana, 46.5%, Nigeria, 44.9%, Malaysia, 38.4%, and Philippines, 38.8% respectively. So the contribution of women in the workplace is gaining more attention and acknowledgement. And we witness more and more world-renowned female leaders who exhibit great leadership and vision in building their countries. For example, the Chancellor of Germany since year 2005, Angela Merkel, and the current Prime Minister of New Zealand, Jacinda Ardern. Okay, besides being a leader, being an employer or employee, women has lots of plays other important role in their life, as wife, as a mother, as a daughter, and the list goes on. With this tremendous stress from work and home, irregular routine, imbalanced diet, and so on, this tends to lower the vaginal immunity and give rise to problems in this intimate part of the body, that is our vagina. So through the understanding of what women encounter and what we truly want to feel confident, to stay happy and vibrant, this is what motivated us to launch Virgin. Okay, so Virgin is formulated to provide an alternative for present-day women to improve our vaginal health, hence reducing a vaginal infection and discomfort by regulating the pH in the vagina. Under normal circumstances and when the vagina is healthy, the pH ranges from 3.5 to 4.4, which is acidic. Okay, and Virgin helps to enhance the growth of good bacteria, okay, in the vagina, and inhibits the bad bacteria. Ultimately, Virgin helps to improve the overall female reproductive system. May Ann, you asked about where
which countries have you? Yes,
products being distributed. All right. So, well, Virgin is available in is currently available in these countries. All right, is available in China, Nigeria, Ghana, the Philippines, Malaysia, and Brunei. Yeah. Yes, Megan. So
yes, thank you so much, Ms. Michelle. You've given us already a brief information or a teaser of what Vagin is. So can you tell us more about Vagin? So I'm sure our viewers, when they first heard about Vagin, their first question will be like, what are the ingredients of the Vagin? What are the active key ingredients of this Vagin?
Yeah, okay. Well, Vagin is a patented ingredient, patented product that comprise of 7 key ingredients, which I like to show it to everyone here. So this includes the antibacterial immunopeptides, the organic acids, the seaweed extract, or also known as the algae extract, the is also known as the prebiotics, vitamin E, and as well as the 100% natural essential oil. So, and these are the 7 key ingredients of Virgin.
Okay, so with this key ingredients, Miss Michelle, what
Mhm.
are the desired effects of the vagine from these key ingredients? What are we expecting with the desired effects of this product?
Okay, so to better understand how Virgin works, it's good for me to share with you the function of each key ingredient in Virgin. Okay, so we'll start off with the first ingredient, that is the antibacterial and immunopeptides. Um, it helps to inhibit the bad bacteria, and it stimulates the body innate immune system to kill the bad bacteria. And the second ingredient, that is the organic acid, is also known as the lactic acid. So lactic acid is it possesses the antibacterial property, and it helps to regulate the pH in the vagina. Seaweed extract is also known as the algae extract. Well, seaweed extract is high in nutritional value, and the extract substance has a certain inhibition and prevention effect on viruses. Okay, and for hyaluronic acid is a very unique ingredient here, and because it has a very unique moisturizing effect, it promotes nutrients absorption by the cells and also the skin, okay, in the vagina. And besides that, it improves elasticity, and it promotes regeneration of injured cells. Polysaccharides, well, is the prebiotics. So it provides nutrients to the good bacteria. So when there's nutrients, it will actually promote the growth of the good bacteria, and to ensure that the good bacteria is functioning effectively. And vitamin E, it maintains the delicate balance of the female hormones, and improves symptoms caused by hormonal deficiency. And lastly is the 100% plant extract, which is the natural essential oil, which is the ylang ylang essential oil. And the essential oil helps to inhibit the growth of bad bacteria, and it be able to calm, soothe, and relaxes our mind and also emotion. So to sum up the function of Virgin based on the function of these 7 key ingredients. Okay, well, Virgin helps to promotes the growth of good bacteria and inhibits the bad bacteria, which it helps to balance the microflora in the vagina. Okay, it helps to regulates the pH level in the vagina, and it helps to promote cell repair, and as well as restoring the vaginal immunity and the self-cleaning mechanism. Yeah, so
Wow.
that is the mode of action and the desired effect of a vagine.
Thank you so much, Miss Michelle Pang. No doubt that this Vagine product is one of the flagship product of Immeri. With just
Yes.
you discussing the ingredients, you know that it's really powerful and, of course, effective. But my next question is on a intending customer point of view. Now that you discussed already the ingredients and the functions of this Vagine, their next question definitely will be, is this product safe? Is there any side effects of this product if I'm going to use it?
Okay, so well, we look at the first. We look at the ingredients of Virgin. Well, the ingredients in Virgin are non-irritant. Okay, it will not irritate the vagina, and the ingredients that we are using is gentle to the mucosa and the epithelial cells in the vagina of the vagina. Okay, and Virgin does not contain chemical disinfectants. There's no alcohol, there's no drugs, or there's no antibiotic, no heavy metals in Virgin. So with this, Virgin is safe to use. All right, and in terms of its effectiveness, besides from what I shared on the functions or the on the key besides that, to actually to see, all right, for us to know how effective Virgin is. So based on the feedback that we have collected from 100 Virgin users, and over 90%, okay, of the users commented that they experienced great improvements after using Virgin. So let me show you the next slides. So from the feedback, over 90% of users agreed that Virgin helps to eliminate odor. It helps to reduce infection and itchiness. It helps to relieve redness and pain. And over 90% of users agreed that Virgin is highly moisturizing, and it has tightening effect, and it helps to improve intimacy. This is from the from our 100 Virgin users. And besides that, we did a clinical test on Virgin in the Philippines. So I would like to share this with you. Okay, so this test was carried out on 30 female participants aged between 18 to 60 years old. Okay, and the participants were required to administrate Virgin on a daily basis over a period of 2 weeks. So after 2 weeks of using Virgin, it shows that Virgin is able to help to reduce vaginal discomforts. This includes itching, burning, hurting, irritation, dryness, discharge, and odor, just after 2 weeks of using Virgin. And the next the second result here. It shows that Virgin helps to reduce vaginal infection. Okay, this includes bacterial infection, trichomonas infection, and fungal infection. This is to show you how effective Virgin is, right? So from the time that Virgin was first launched in China till date, where now it is available in other parts of the world, Virgin has helped more than 1 million women from different countries around the world to improve the intimate issues. With more than 100 doctors agreed and satisfied with the results. So may end with the ingredients that is safe and also safe and gentle to the vagina, as well as the feedback feedback and the clinical test on Virgin. I could confidently say that Virgin is safe to use and is effective.
Wow. Yeah. And with that effectiveness, I don't have any further questions with that. Ms. Michelle, you've given satisfying answers on how effective, how safe these products are, this Virgin is. Okay, thank you so much, Ms. Michelle. So another question, I have last two questions for you, Ms. Michelle. So
yes.
Among, we have a lot of products for women nowadays already, right?
Yeah.
So my question is, why do you invent Virgin despite there are many feminine products in the market?
Okay, well, I would like to touch on Virgin first. Well, Virgin is formulated using ingredients that is gentle and safe on the mucosa and also epithelial cells of the vagina. And it is, the ingredients in Virgin, it nourishes the cells and it promotes cell repair. Virgin helps to enhance the growth of the good bacteria, that is lactobacillus, and it inhibits the bad bacteria. On top of that, it helps to regulate the pH in the vagina. So as you can see, Virgin it basically covers the function. What our vagina needs. Okay, so I would say that vagines serve as a holistic alternative to restore the vagina's innate immunity to reduce infection. Well, whereas for feminine wash, okay, it contains cleaning agent that is harsh. It could be harsh to the skin and to the cells in the vagina. And moreover, the feminine wash tends to be more alkaline. As we know that our vagina is acidic, so when you are using the feminine wash that is tend to be more alkaline, it will actually affect the pH in the vagina. This will eventually cause inflammation to the vagina, and subsequently it may lead to infection. All right. So as for instance, a tablet, okay, the tablet suppository. All right. Well, it might give you an instant relief on vaginal infection and vaginal discomfort. However, it is not a long-term solution. So, therefore, virgin will be a better choice, okay, as a holistic alternative to improve our vaginal health with its non-irritant, gentle, and safe ingredients. Yeah.
Yeah. Thank you so much, Miss Michelle. That is actually the thing that women nowadays are looking for to a product, especially if you're gonna
Yeah.
use it into your intimate part. Not just effective product, but also safe product.
Mm,
So thank you so much once again, Miss
safe.
Michelle. So my
Correct.
last question. So my last question for you today,
Mm-hmm.
okay? So what makes the jean stand out in the market, and why do you think it should be the preferred product?
Okay. Well, there is three points here, okay, that I'd like to share with you. So, well, Virgin is a patented product. All right, uh, and basically, Virgin is an innovation patent. So there is two type of patent in the market. That is the innovation patent and the conventional patent. Well, innovation patent refers to a new creation or new invention, whereas conventional patents refers to the enhancement to ingredients of an existing product. So with the Virgin Innovation Patents, it denotes that Virgin is unique. There's no other in the market like Virgin. Okay, and secondly, Virgin is scientifically proven to enhance the growth of beneficial bacteria. It has anti-pathogenic property. It helps to restore the vaginal immunity. The Virgin Refreshing Intimate Gel has a high adhesive ability, where it be able to spread evenly and cling on the vaginal wall effectively. Well, the nutrients in the gel is being released slowly over a period of 8 hours. Why? Is because we want to ensure that the in the gel is being absorbed into the cells optimally for nourishment and as well for cell repair. And I would also like to emphasize again that Virgin contains ingredient that is gentle, safe, and non-irritant. And research and development has been carried out on Virgin for several years before it's being launched into the market. And Virgin was first launched in China and Taiwan due to its large population in these two countries. And right now, Virgin is being distributed to the Southeast Asian countries as well as to the African region. And lastly, all right, Virgin is manufactured in the sole manufacturing facilities built in compliance with pharmaceutical standards. Facility is fully automated. It's being monitored under stringent, and the facilities produces 140,000 pieces of Virgin per day. Okay, and the Virgin manufacturing facilities has been certified by the US FDA in year 2019. So with the Virgin patent, the innovation patent, the scientific research and study, and the state-of-the-art manufacturing facilities, we are confident that Virgin is able to help women around the world, regardless of race, ethnicity, age, to be confident and be happy always. Yeah.
Wow.
Thank
Thank you
you,
so
Amy.
much, Miss Michelle. No wonder I'm hearing a lot of women saying that Vagine is their new best friend. Okay, thank
Yes.
you so much.
So,
Thank you so
thank you,
much once
Mayan.
again, Miss Michelle Pang, on sharing with us this amazing product, the Vagine Refreshing Intimate Gel. So I'm sure those who are listening now or those who are watching us now, not only women but also men, are now more keen on knowing more about this product. So thank you so much once again, Miss Michelle Pang.
All right.
Thank you.
Welcome.
Okay, so before I call back the doctors to this platform, let me just once again let you watch. I will just let you watch once again this short commercial break. Hello, and you're still watching us live on our first International Medical Forum. A while ago, on our first part of our Q&A portion, we have talked about the most common problems of women reproductive health that Africans and even Asians are facing. And now we will be talking about how to prevent or the alternative ways to prevent these issues. So once again, let me call back to this platform our doctors, Dr. Glenda and Dr. Mercy. Hello, welcome back, Dr. Glenda.
Yes, ma'am. I'm back.
Hi, Dr. Mercy. I hope you've rested in few minutes.
Yes.
So how's everyone? Okay. So now let us move on already to the next part of our Q&A. So I'll be asking questions and both of you can answer regarding with how you observe this in your continent or in your country. Okay. So I understand that both of you have experience in prescribing Vagine to your patient in both of your countries, right?
Yes,
Yeah.
right.
So my first question to Dr. Glenda, okay? Dr. Glenda, would you be able to share with us your medical experience using Vagine to your patients?
Yeah. Actually, I made a study on the utilization of Vagine gel
Wow.
among my patients in the area last March 2019. And I found out that Vagine gel is a very good alternative treatment in addressing uh, the treatment of vaginal infections like bacterial vaginosis and yeast infection. And also, it improves vaginal discomfort. And one additional benefit of this gel is on the improvement of the sexual experience of couples with no side effects. So since then, when I made that study, so I have the confidence now to use that gel. And at the same time, I already promoted to my colleagues and, of course, to my patients. And they benefited a lot from this gel, especially in cases of infections, postmenopausal, my post operations. They really like this gel.
Wow. Thank you so much, Dr. Glenda. Wow. It's really amazing that you didn't just try to use it with your patient. You really made a study about
Yes.
how effective and how safe this product is. So thank you so much. Dr. Mercy, can you share us also your experience on prescribing Vagine to your patients?
Okay. So my experience is not different from that of Dr. Glenn. So for my patients who were coming with a lot of vaginal discharges and we were doing a lot of laboratory examination and finding nothing, no cause, I introduced the vagina to them, and it has a way of balancing the pH of the vagina. So even without the traditional treatment, the orthodox treatment, I realized that the discharges and then the discomforts reduced drastically, and those patients were not coming back to me anymore because they had had the healing they were looking for. And for my menopausal women who were having a lot of dryness and pain during intercourse, when I introduced the vagina to them, they came back with a saying of the place being moist and they enjoying their sexual life. And then all sort of small infections they were having down there, all were cleared. And for patients who are infertile without any cause, we have had a lot of testimonies on giving them just vagina to try to see if the vagina will solve the issue down there. So we have had a few babies in Ghana come out as a result of using vagina.
Wow.
And women who had pain without any cause, we have had some discomfort relief. The pain has gone down. And the one I am excited about is women who are having problem in the bedroom. They come up with smiles in their faces saying that their partners like the product so much, and they, especially people who have not enjoyed their sexual activity with their partners, they come back to say that when they use the vagina, they have had some kind of pleasure and some tightening effects down there. So vagina in my practice, I have had a lot of positive results from using the vagina.
Thank you so much, Dr. Mercy. No wonder why there's another famous slogan that I've heard in Ghana before, that this vagina is a product for women but loved by men.
Yes.
Thank you so much, Dr. Mercy. So my next question will be, Dr. Glenda. Will you agree with me that most patients are not sensitive in taking care of their reproductive system until they encounter its own problems?
Yes, I agree. Because we all know that women are known to be patient. They just ignore their mild symptoms and just go to the for consultation if they can no longer tolerate their symptoms. So when they come here, they already have complications. So sometimes they are not really sensitive.
Mm-mm. Yeah. So even in Philippines, women have this mindset that they will only go for consultations once they have these serious issues already. How about in Ghana, Dr. Mercy? Is
Yes,
that the same scenario?
it is the same over here. Women will ignore most of the signs and symptoms, and by the time they come, the problem is already complicated, and more especially because the problem doesn't give any signs and symptoms. If you don't prevent, you will not see anything. By the time you see the charges, by the time you you smell an offensive smell, by the time you feel pain in your lower abdomen, that means the infection has gone deeply into deeper issues. And then when you come, it is a bit complicated to give you solution. So I agree, it's the same thing here. Most women do not take care of their reproductive system, their vagina area, because we are too busy, we ignore. I mean, it is not an outer organ that people can see. It is hidden down.
Correct.
If I don't polish it, if I don't do anything to it, nobody will know. But meanwhile, there are serious problems happening down there. So it is the same thing in Ghana.
Yeah, thank you so much, Dr. Mercy. So my next question is that both of you have mentioned a while ago, even Dr. Khan, that the occurrence of bacterial vaginosis, yeast infection, excessive discharge is very rampant in any part of the world. Maybe it is diagnosed or even undiagnosed. So what is your advice to all women out there to reduce or even to prevent from having those kinds of problems or issues? Dr. Glenda?
Okay, in order to prevent the occurrence and even the reoccurrence of this vaginal infection, of course, number one is to avoid the risk factors. Risk factors like being stressed, or you have to look under hygiene. The proper hygiene is very important. So they have to check what they are wearing, should be cotton, and the use of the unscented pads. We have also a product like this. I enjoyed much of this offer. Okay, and the use of douching, you should avoid it also. And of course, I actually, Ma'am Michelle already mentioned about this, the proper hygiene. So they have to observe it and the avoidance of the risk factors.
Okay, thank you so much, Dr. Glenda. Dr. Mercy, any advice to all women out there on how to avoid or even prevent these common health problems to women?
Okay, so I will add up to what has been discussed so far. Make sure you are not too stressed. Even if you are stressed, you take some rest because your whole body and your systems depend on it. And then practice very, very, very good sexual hygiene so that you don't introduce infection down there into your reproductive tract. And then also feed your vagina with the right food. Also in Ghana, we say vagina is food for the vagina. Yes, as much as you are taking all sorts of medication and chemicals for your health, make sure you give your vagina the right kind of food so that it can also keep the place in safe and have the natural protective mechanism the vagina has been designed to do. So let's just take care of ourselves as women. Basically, that is it.
Yes, thank you so much, Dr. Mercy, Dr. Glenda. So I have two more questions for the both of you. So second to the last question, we know that hormone estrogen is very important for women to support the health of the vaginal tissues for secretions, for its elasticity, and even for its thickness, right? So this hormone may decrease when a woman hits the menopausal stage or even at the perimenopausal stage. So these things can lead to dry irritation, thinning of the vaginal lining, and also create an environment that are susceptible to vaginal infection, which ultimately can cause intimacy problems among couples. I know you've touched this a while ago, Dr. Mercy, but let me just do a recap about this one. So what can we do to overcome this issue? Dr. Glenda?
Okay. Actually, the menopause is a very challenging stage in women's life, especially the sexual reproduction of couples, and it will greatly affect the intimacy of their relationship. That will, as you have mentioned, that it will lead to dryness, irritation, and infection. And I have a great advice on this during my clinic when I gave this ADC gel, this vagin gel. They have a good experience of this, that it will cover the infections because vagin gel has, as we have mentioned, it has an antibacterial, antifungal, antiviral, and it is a very good or excellent moisturizer. So they will overcome the sexual dysfunction using this. And of course, a lot of management also when it comes to menopausal stage, like we have giving them supplementation because of the problem of the hormone. Supplementation, it can be a synthetic or organic. So one example of this organic is that gel.
Okay, thank you so much, Dr. Glenda. Dr. Mercy, any advice on how to overcome this problem?
Okay. So for the dryness experienced in the menopausal stage, because the estrogen is gone, there is no way you can bring it back. So we have products that give you artificial estrogen in your system to help boost that. And then locally, you take care of the place because it is so dry, the vagina cannot do the right preventive thing, self-cleansing it is supposed to do. So that you tackle the problem locally from, the vagina area. Product or anything that will make the place moisturized. And I know vagina has an ingredient that has the ability to hold water. So when you have a lot of water in the cells in your vagina, the place is most of the time moisturized, and then you reduce the dryness at that stage. and basically prevention. At that stage, you need a lot of prevention because the vagina has lost its protective activity because of the less estrogen in the body, in the woman's body.
Okay, thank you so much, Dr. Mercy. So basically, let's just remind everyone to keep feeding the vagina with the right food, which is the vagine. Okay, thank you so much, Dr. Glenda and Dr. Mercy. So my last question for the second part of our Q&A, what is your advice to all women out there on the importance of reproductive health?
Okay.
Thank you,
To
Dr. Glenda.
to my fellow women out there, reproductive health is important to our general health and well-being. So it is important to take steps to protect from infections and injury. And taking care of yourself and making healthy and safe decisions or choices can help protect you from your loved ones. So the choice is yours. So stay happy and simple, stay safe and healthy. Thank you.
Thank you so much, Dr. Glenda. Dr. Mercy, any message or advice to all women out there on regarding with how to take care of their reproductive system?
What I have to say is, if you are a woman and you want to have your kind or reproduction, you want to bring a life or a baby into this world, as much as you take care of your skin, your face, and other areas of your body, you should take very good care of your reproductive system. That is if you want to have children. Because if you don't take care, the place can really mess you up. You cannot have what you are really looking for. So basic prevention, hygiene, feed your vagina, and all that. Let's just take care of our reproductive system. That is what I have to say to the women out there.
Yes, thank you so much, Dr. Glenda and Dr. Mercy. That is the end of the questions from my end. Now, let me get some questions already from our chat box. Okay, so as you can see, I have some questions for both of you. So I'll be asking the questions from our participants today. And both of you can actually share your thoughts on these questions. Okay, can I start already, Dr. Mercy, Dr. Glenda? Okay, so my first question is, can patient with vesicovaginal fistula benefit from vagine or VVF? Dr. Mercy?
Okay. So if you have a fistula, this is a surgical condition. I advise you see your obstetrician gynecologist or your surgeon to take care of the fistula out there. And then when your surgery is done and you want a speedy recovery or healing of the place, why not? You can go on vagine to help with the healing. But it is a surgical condition that a doctor, a surgeon, obstetrician, gynecologist should be able to take care of.
Okay, thank you so much, Dr. Mercy. Dr. Glenda, any thoughts about this? Can a patient with vesicovaginal fistula benefit from vagine?
As an obstetrician, I think we have to treat first the problem by referring it to our friends, surgeons. And then afterwards, we can actually use this vagine to improve or to prevent the entry of infections and also promote healing, as what Dr. Mercy have said.
Thank you so much, Dr. Mercy, Dr. Glenda. So my next question from our viewers is, does PCOS have anything to do with bloating? Dr. Glenda?
I think we don't have problems of bloating in the polycystic ovarian syndrome. I don't have any experience. However, if you are having problems of hormone, like if you have more than progesterone, it can cause bloatedness, or there are other causes of bloatedness. So
But is Dr. Glenda, I just have a question. Is gaining weight part of the symptoms of having PCOS?
yes, because of the insulin resistance. Actually, obesity can aggravate the symptoms of the PCOS. So
Okay.
it aggravates.
Okay.
Because
How about
resistance.
okay, thank you so much, Dr. Glenda. So my next question is, how does vagine provides nutrients for the friendly bacteria? I think Miss Michelle have touched this part a while ago, but Dr. Mercy, can you just do a recap with this question? How
Okay,
does
so
vagine provide nutrients for the friendly bacteria?
it feeds it. It feeds the friendly bacteria, and the vagine also provides a very good atmosphere for the friendly bacteria to grow. The more you have the friendly bacteria, the less you have the bad bacteria. So vagine provides a very excellent environment for the friendly bacteria to thrive so that it can overcome the bad bacteria. And it also, the organic acid in there feeds the good bacteria over there. So it serves as food, feeding for the good bacteria, and also a very conducive environment to have more of the friendly bacteria so that we can have less of the bad bacteria.
Okay, thank you so much, Dr. Mercy. A while ago, you've mentioned, Dr. Mercy, that one of the common issues of women reproductive health in Africa is also fibroids, right? So
Yes.
one question here from our audience: can vagine help in the treatment of fibroids?
Okay, so fibroid is a very big, it's a very big and complex condition. It depends on the location of the fibroid. If the fibroid is located inside the womb, that is where the baby will be, and you have all sorts of ulcerations or injuries down there, the vagine can help. And we have had instances where the vagine has been able to help with the fibroid pain, but vagine does not shrink the fibroid, if that is the solution the woman is looking for. Or vagine does not remove the fibroid. It doesn't shrink, it doesn't remove, but it has a way of relieving the pain and the discomfort the fibroid is giving you. So that's what vagine does. It doesn't remove and it doesn't shrink the fibroid, but it helps, in the environment so that the pain will be less. The infection that will come into your womb as a result of the fibroid being there can also be prevented. But vagine does not shrink or remove any form of fibroid. But we have had some people with relief using vagine when they have the fibroid condition. I'm sure the obstetrician gynecologist will have better answers than I do.
Thank you so much for that forward answer, Dr. Mercy. So any thoughts on this question, Dr. Glenda? Let me just repeat the question. Can vagine help in the treatment of fibroids?
Actually, based on the cause of the fibroids, and that is genes, more on the genes, and there is a proliferation of the smooth muscle, I think there's no study or any content of the gene that can shrink or can improve the fibroids. So maybe there's need to further study on that.
Yeah, thank you.
Because
Thank you so much. Yes, thank you so much also, Dr. Glenda. So a while ago, we've also touched the problem about infertility. Okay, so we have one question here from our participants that what can a woman suffering from adenomyosis get through fertility issues? This person had over 8 miscarriages already and no child yet at age 40. So I think she is asking if vagine can help her with this issue. Dr. Mercy?
Okay. They are asking a lot of difficult questions.
They know the doctors are in. So they took the opportunity to ask this technical question.
Yes. For the condition she's talking about, adenomyosis, vagine is not the ultimate treatment. But, infertility is very interesting. If you ask the fertility specialist, the most important thing is you take care of the place. Make sure the place is conducive for conception. For all you know, if you are treating a condition and then you are ignoring the environment where the baby will grow, that's where the baby will not even come at all. So vagine is not treatment for adenomyosis, but if you are treating infertility in general and you have a very good medium for the baby to implant and then thrive and then grow, why not? The person can try vagine. That is what I have to say.
Thank you so much, Dr. Mercy. So let me just now proceed for the next question for Dr. Glenda. Okay, with the use of Vagine in cases like PCOS and infertility, how does the patient use the product and also the duration of usage?
For the use of a gene in infertility, it depends on the reason of infertility. So there are reasons if you have infections in the vagina, it can cause killing of the sperm. That would be the good effect of the vagine that improves the infection first that may lead to infertility. So the vagine can benefit on that. Okay. However, in polycystic ovarian syndrome, I think the effect of the importance of giving vagine, I think there's no study, there's no yet study on the effect of vagine on the polycystic ovarian syndrome.
Okay. Thank you so much, Dr. Glenn. That leads me to another question for Dr. Mercy. Okay, can vagine contribute in preventing endometriosis, or can it lessen at least the pain during menstruation?
Of course, of course. It lessens the pain during menstruation. Vagine relaxes the muscle where the blood is being pulled from. So women who are on vagine for some time, per the data we have gathered, more especially in Ghana, they say that the pain they experience during their menses, that is dysmenorrhea, has drastically reduced for some women. So vagine has a way of relaxing the muscles of your womb, so that when you're going through your period, the pain can be brought down. Yes, much better.
Wow. Wow, thank you so much, Dr. Mercy. So another question for Dr. Glenda. What effect do vagine do to the cervix?
Okay. We have mentioned about the contents of the vagine. It has an antibacterial or antiviral like that. So the vagine will protect the entry of the pathogens to the cervix. So it maintains the integrity of the cervix, the healthiness of the cervix, and the environment of the whole cervix. That it will serve as its protection to the entry of the bad bacteria.
So basically, Dr. Glenda, vagine is a prevention product for the entire cervix or for the entire internal organ of our reproductive system. Okay. So two more questions from our yes, Dr. Glenda.
Because if you cannot prevent the entry of infection from the cervix, it will go up. It will lead to complications like
Yes.
diabetes, PID, that will lead to infertility.
Yes, that is perfect, Dr. Glenda. Of course, once we take care now of our intimate part, preventing it for further infection is a must nowadays. So my next question, Dr. Mercy, okay, does PCOS have anything to do? Okay, this one has been asked a while ago about the bloating. So is it okay to feel burning sensation when you are using vagine?
Yes.
Dr. Mercy?
Yes. The first time I used vagine, I had a slightly burning sensation down there. I didn't understand. When I studied the product, I began to have answers to that. Yes, you, not for everybody, but for some women, you feel a pinch of a burning sensation down there for a very short period. This is because that your vagina area has become alkaline, and if you were studying the teachings from the beginning, the place has to be slightly acidic. So that is the way the product is introducing the acidity to your vagina area. That is why it burns just a little. So it is part of the healing process. Your place that is alkaline is being moved from the alkaline state to a slightly acidic state, so that you can have the full benefit of the product. So it is very normal, especially on the very first day you use the product. It is very normal.
Okay. So all the women out there, if you've used vagine for the first time, have you experienced what do you call this, burning sensation, don't be nervous or don't panic, okay? It's a normal feeling for those some women who have used the vagine. Okay, another question for Dr. Glenda, is vagine recommended for women that have undergone hysterectomy?
Yes.
Okay.
When you had hysterectomy, especially if both ovaries are already removed, also that is tabiso, there is already a state of menopausal. There is a decrease in estrogen level that leads to dryness, irritation, and infection. So vagine is very important as an antibacterial, antifungal, antiviral, and it's a very good moisturizer because of the content, the vitamin E, the oil, etc. So that would be a very good moisturizer for post-operation.
Okay, thank you so much, Dr. Glenda. This leads me to the next question, okay? How often should a woman with menopausal issues should use vagine? Either already at the menopausal stage or perimenopausal stage? Dr. Mercy?
Okay. So for a woman who is in her menopause, vagine should be your friend. You need it. It is very important. I mean, the estrogen that is keeping you beautiful, nourished, I mean, very moist down there, it's gone or it is almost gone. So vagine is a product that, I mean, should be your best friend. You should have vagine around all the time. As to how often you should use it, as often as you can. As often as you can. If you've been introduced to a product, the person that introduces you to it will tell you how you apply vagine. But for somebody in the menopausal period, you need vagine to help the place become moist. You need vagine for lubrication. You need vagine for the discharge, the dryness, the itchiness, all the conditions over the prevention of infection. So a menopausal woman needs vagine a lot. That is what I can say.
Okay, thank you so much, Dr. Glenda. Any additional information about this question, Dr. Glenda? Any additional thoughts?
In my clinic, if you are menopausal, there is a decrease in the absorption. So I usually give it at least 2 times a week. That it depends on the symptoms of the patient. If the patient has a present infection, you can give as often as you can. It can be every day or every other day until the symptoms subside. And then you can maintain it twice or once a week thereafter.
Okay, thank you so much once again, Dr. Mercy and Dr. Glenda. You've answered all the questions very straightforward and very well. Okay, I still have actually a lot of questions from our comment box, but due to our limited time, I invite everyone, our 340 attendees, as of the moment, to please visit us to our website, www.immerigrowthuniversity.com, and you can send your inquiries and further information about Immeri, okay? You can also drop your questions and we will be in touch with you, okay? So for those who we haven't tackled their questions on our comment box, just visit us once again at www.immerigrowthuniversity.com, okay? Just click the country and location and send us your concerns or your further questions with regards with our forum today, okay? So once again, thank you so much, Dr. Glenda, Dr. Mercy. I know in Philippines it's a bit late already, but thank you so much. We salute all what you've done for especially in this pandemic time, okay, as the frontliners. Thank you so much once again. Thank you so much. Medase pa, maraming salamat po, Dr. Glenda.
Welcome.
Okay, thank you so much. And to all our viewers, to our live viewers for today, to our 346 viewers, okay, I know you want to hear more about our on how to take care of a woman's reproductive system. That is why I am inviting you to another event coming up on Monday, same time, 1 p.m. Nigeria time, 2 p.m. Egypt time, 11 a.m. Ghana time, and 8 p.m. in Asia, okay, for an insight of women reproductive health. That is again Monday, 22nd of June, 1 p.m. Nigeria time. So we will be sending you the link for this event through your emails. Okay, same platform in webinar. Okay, so everyone is invited for this another training with also our outstanding and amazing speakers. We have Dr. Kan Kok Ming, a neuropathic doctor and also a health consultant who have joined us a while ago. And of course, Miss Michelle Pang, our product trainer and a senior nutritionist, plus a very surprise guest for everyone. So please watch out, be part of us on Monday, again, 1 p.m. Nigeria time, same platform, and we will be sending you a reminder with regards to this webinar meeting, okay? So once again, thank you so much, everyone. So actually, I just want to share to you my thoughts about this forum today. I've realized upon hearing all the informations or insights from our panelists that I have realized that a lot of women are still not aware that a woman's reproductive system is a delicate and a complex system in the body, okay? Awareness and understanding is one important step to protect it from infections and injury and even prevent problems, including long-term health problems. So to all women out there, taking care of yourself and making healthy choices can help you protect not just yourself, but also your family. So once again, to all our viewers globally, nationwide, thank you so much for participating or for watching our first ever International Medical Forum. Thank you so much. Maraming salamat po and good night, everyone.